My name's Greg. I prefer that to Dr. Pyle because I tell all our patients when you sit in my chair, you become my friend. And we treat all our patients like they're our friend. I probably told you that the other day, didn't I? So, a little bit about my journey. My journey started, holy cow, 35 years ago. Well, sorry before that, but my journey in private practice started 35 years ago. And I knew when you come out of dental school, you know about this much to do no harm. that's your goal, and so you know how to do fillings on teeth and a crown or a denture. And so I started my whole health journey completely wrong. So all these guys in the early 2000s, they were all doing these beautiful smile design days. So I'm like, whoa, that sounds really cool. I think I'll go to a class about that. And so I learned how to do that. I did it, and the first patient, they were like knocking their veneers off. So, oh no, what's this all about? And they didn't cover that in the 4-weekend course that I took. And so then we went back and we took some classes on how teeth come together, which you would think you would know that sort of thing in dental school, but unfortunately it's briefly mentioned in an afternoon lecture on a Friday. And so we learned that stuff. But the bigger picture was, why are people putting their teeth together? Because when you think about that, there's really no time your teeth should ever be touching. So your teeth come together for a brief moment when you're chewing. You get through the food and they touch and maybe you get another bite or you're done. But when you're just sitting here, your teeth shouldn't be together. So what we found, not me, what I found in research was that people put their teeth together when they don't breathe well. I need air. They also do it when they're stressed. So needing air is stress too, by the way. And so that started the whole journey. And so we knew these people who were knocking veneers off were putting their teeth together for some reason. I had them in the right spot, but they were doing stuff. So that led us down this journey to start looking into Airway. And at that time, this was, I'd say 2005 or so, dentists were just starting to put their big toe in the water and start thinking about treating Airway. And I went on a fishing trip with my dad, and I slept in the car because he snored so loud, and he felt horrible. And I said, "Oh, Dad, I slept way better in the car than I can in that little cabin." And so as soon as I got home, I signed up for my first Airway course, and Dr. Barry Glassman. So you might look that name up. He's probably near retirement now, but he was a pioneer in some of the Airway treatments and so forth. Barry Glassman. Yeah. And so he taught me how to make my first sleep appliance for adults. And so my first patient was my dad, and now he's 83 and he's still wearing his sleep appliance. Here we are 20 plus years later, and he still has the same one, still wearing it. And I don't know that that's why he's lived as long as he has, but part of me has to think that sleeping better has helped him live, because he's not my healthiest patient that comes in my office. He has all the morbidities that you see in older adults. He's a type 2 diabetic, he's had heart bypass surgery, and former smoker, and so he has all those things. But he's a little Energizer bunny, he just keeps going. So then I just strictly made sleep appliances for a few years, only on adults. And then dentistry started really rallying around an idea that, hey, this is something that started way before adulthood. This is something that started in these guys' age. And so probably in the mid 2010s, I started taking all these courses offered by Myobrace. I don't know if you've heard of any of those. About anything about Myobrace. There's another tooth pillows, kind of a similar product out there, and they're starting to pop up everywhere. And Myobrace was kind of the first one. It was developed in Australia, so they were doing it in Australia way before they got it here. But what we were seeing in our adults was that the majority of these adults, or a lot of them, had orthodontics when they were kids. And their orthodontist pulled 4 teeth and pulled teeth back because that created more space, but it created less tongue space. And so people aren't going to walk around with their tongue sticking out, so they had their tongue go backwards. And backwards means it goes into the airway. And so, quite frankly, and I didn't know it at the time, I was just making sleep appliances, which, guess what it does? It pulls the lower jaw forward, and the tongue comes with it and comes out of the airway. So anyway, what we were doing as dentists, I'm not throwing any orthodontists under the bus or any dentists under the bus, because we only knew what we knew. And you do the best you can with what you have, and then when you learn better, you do better. And so it wasn't until probably 2012 to 2015 that dentistry started going, this is something we've been doing for a century that hasn't been good. And so now, if you go to a traditional orthodontist, they're probably not going to want to pull 4 teeth and pull teeth back. But certainly, if you do go to an orthodontist that wants to do that, don't let it happen. Because you'd be setting your kiddo up for a lifetime of issues. So we want to expand out and give the tongue more space rather than pull back. So this starts into what Jody was talking about just a few minutes ago, in that the tongue oftentimes is just in the wrong spot. So let's go back a little bit and go talk about infants. Infants innately don't know how to breathe through their mouth. They only know how to breathe through their nose. We're wonderfully made. I think we're all on the same page there. And we're wonderfully made, but sometimes we get in our own way. Sometimes they have a tethered tongue. They can't get their tongue to the right spot. And those babies have trouble nursing. Sometimes they get a cold when they're an infant, and for whatever reason, they learn to breathe through their mouth, but their brain says, oh, that's easier. So let's just breathe through our mouth. I'm going to make you do a test right now, but if you open your mouth and have your tongue down and now breathe through your nose, you can't do it. But if you put your tongue to where it's supposed to go, you can breathe through your nose all you want. So you're, in essence, just sealing off that oral cavity so that no air can go in here and it has to go here. If you're tongue-tied, it can't happen. There's no way to do it. So we have to sometimes modify the tongue. Gabe knows all about that. And anyway, it's way easier to do on an infant. We've done tons on infants. It goes really fast. It's such a wonderful feeling when mom's kind of crying, the baby's crying, the doctor's crying, and we relieve that little tongue tie, and then instantly go back to our back office and nurse. And like nursing, it's really a miracle. And so we started doing that a long time ago. We do it with a laser. Traditional did it with scissors. That's not good.
It doesn't smell good.
Yeah, the laser. Yeah, but there's no bleeding.
That's true.
So there's that. So the whole system that we use with the Myobrace or whatever system we have is to teach our patients to have their tongue in the right position and to coach them to do so, that no matter what, even if they fall asleep and their mouth is slightly open, that their tongue's in the right spot and they're still breathing through their nose. Now, I've told Jody this, and I may have told you guys this. I'd give my life savings that I had this knowledge when my 30-year-old daughter was their age. I mean, because it's hard to change things in an adult. So it's best to treat these kiddos when they're still growing. We jumped in real fast. How old are you, Naomi?
14.
So Naomi's probably been growing. Girls stop growing a lot earlier than boys, and we knew that our window for success probably was not going to be very big for her. And so we did things a little different with the mechanic kids because one, we were dealing with 2 boys, and so boys don't listen as well as girls do, right? Okay. And Naomi, unfortunately, was at the back end of her window of growth. And so I wasn't sure that the Myobrace system alone would help them. So we did more like clear liners on all of them. And I'm going to show you some things here in a minute. Clear liners with some myofunctional coaching. Whereas most kids, though, would just typically just do the Myobrace. So the Myobrace is a series of liners, mouth guards, so to speak. And I'll let you pass these around in a second. But they have a little shelf where the tongue sits, so it trains the tongue while they're wearing the mouth guard to be in the right position. With our coaching, and we coach these kids every month via Zoom or in person, one or the other. It's only worn at nighttime and just a little bit during the day, an hour or so during the day, and it's been unbelievable. It was the very first, probably 10 years ago or so, when I took that first class, I'm like, this little hooey, I mean, what can these little mouth guards do? And we have seen, when you can change the health path of a kiddo, it's really a miracle. And it's not just, it's not lenient. It's just things that we have been able to help kids get into the right position to heal themselves. And we all know that our best healer is ourselves. So let me show you these appliances. So I have this slide presentation that's more for doctors, and I'm not going to go through that. So, but there are a couple pictures I do want to pull up. So here is the actual Myobrace, and you guys can pass this around. But kids wear this. Here's that shelf I was telling you about, and then there's a little target that we coach our kids to put the tip of their tongue on the target. Okay, and they're not like custom fitted for kids or for patients because we want their muscles to develop in order to hold this in. Okay, so you want to pass that around. So we get them started on these little appliances. And the first phase of the Myobrace is purely functional, getting them to breathe through their nose. A little bit about nasal breathing. So nasal breathing is, I'm sure you guys know all this, but I'll tell you anyway, but nasal breathing is so much healthier than mouth breathing. When you breathe in and out through your mouth, air comes in very fast and it leaves very fast. Our healthiest people have a very good supply of nitric oxide, and if we breathe through our nose at the blood gas level, because we're breathing in slowly and then breathing out slowly, that nitric can form. But when you breathe in and out of your mouth, it happens too fast, and so everybody's low. And so therefore that affects the immune system and it affects all sorts of things. The other thing is the mouth's meant for talking and chewing. Period. So you know all this stuff.
He preaches the tar cakes.
Yes, talking and chewing is all the mouth is for. So when you breathe through your mouth, it wasn't meant to catch all of the things that are in our air right now. Our nose has hair follicles and mucus that catch those things and keeps us healthier by breathing through our nose. When you breathe through your mouth, those are all our kids and adults who have swollen tonsils. Tonsils catch everything. And so therefore, they're all swollen, like my daughter, who had to have her tonsils removed because they got so big and they got scarred, and so they would not shrink. We've seen lots of patients who, after we coach them to be nasal breathers, their tonsils shrink. They don't have to have their tonsils removed.
Yeah.
That's a big deal because tonsil removal is very traumatic. Very traumatic on, like, my daughter, who did it when she was 27. But unfortunately, we didn't have the choice. I mean, she literally had canker sores this big in the back of her throat for 2 to 3 weeks. It was painful. I felt awful. But she got through it, and you know, she's better than she was, and I forgot to tell you, my daughter is very stubborn. And sometimes thinks dad's out there. But she's definitely healthier than she was. Okay. Here's the other thing that mouth breathing does. Mouth breathing, because it happens rapidly, it boosts your heart rate at nighttime. So if you're breathing through your mouth at nighttime, your heart rate's going to be elevated somewhat, and your brain thinks you're being chased by a tiger. So consequently, you build up a lot of cortisol. Cortisol's belly fat hormone. So people who mouth breathe a lot are in this vicious cycle. They try to lose weight. This is my daughter, but they can't lose weight because, one, they're building up too much cortisol. Two, and at the wrong time. We're supposed to have cortisol, but not in the middle of the night. Two, their heart rate is elevated enough that there are different stages of sleeps, 4 stages of sleep, and they're never getting into the last 2 stages of sleep, which are the healing phases. Stage 3 is your muscle healing phase, and stage 4 sleep is your brain healing phase. So that's why if you read articles about adult obstructive sleep apnea, and they say, well, these patients are higher at risk for heart issues, but also brain issues, dementia, and those types of things, because they're becoming apoxic and they're not getting enough oxygen to their brain, period, because it's just breathing in and out so fast, and so it just doesn't do what it doesn't circulate in your blood system. Sorry, I got off target there a little bit. So other things we want to talk about with these types of systems is diet. So if you go way back, those doggone English people started a refined diet about 200 plus years ago. Ladies, you're not old enough yet, but when you get in the 50s and 60s, your medical doctor is going to tell you that when you do a workout, muscle builds bone. Okay, so females tend to have bone density issues. And so we know that resistance training is really good for females to help support bone density. Well, guess what happens to our bones when we eat a refined diet? Jawlines are smaller. So if you go back and they've done this, if you dig up skulls from 200 plus years ago, everybody had their wisdom teeth. Everybody had jaw structure to support their wisdom teeth. And all you have to do is turn on the television and watch, and faces get narrower and narrower and kind of shaped like this because these jaws are just not doing any work. Where do we get our protein? Protein shakes. I understand I'm not poo-pooing on the vegan movement or vegetarian movement, but also a lot of those things people don't chew. They're just not chewing very much. And so kids this age, I recommend getting stuff that make them chew. And as soon as they get teeth, we have a granddaughter who's 8 months old. She has 4 teeth now, so she's on solid food already. She's using those jaws. And so we want those jaws to develop. So what happens when they don't develop is there's no space for jaws are smaller, and so there's not enough space for teeth. When there's not enough space for teeth, there's not enough space for tongue, and it's just kind of a vicious cycle. Back to our tongues. I know I'm going all over the place here. I'm not a public speaker, so the tongue space or the tongue position thing is if we have our tongue, not just the tip of it, but the whole tongue up against the roof of the mouth, the teeth fall into place. So what we see with this Myobrace system, we've been doing it now for, like I say, 10 years. We've had 2 patients that needed a little bit of orthodontics at the end to get what mom said was the perfect smile for senior pictures. The rest of them come out and their teeth are really straight. And the 2 that did it, we could have gotten by without it. Had they been boys, we probably would have never done that. The moms wanted their daughters to have perfect. And they were literally in clear aligners for maybe 6 months. So it was in and out real fast. It was very minor. All that said, if we put kids in the right position when they're growing and developing, things go really smooth. So let me show you a few other things. So we have you saw the actual appliance. This one is a trainer. This is for little ones, like my granddaughter. And so this is to help them to start to chew. So you can make it a game like a tug-of-war game. They bite down, they hold it, you tug at it, and then you flip it over and do the other side. And you do that every day. And it doesn't take very long for kids to say they want to do it. And they just walk around the house doing it. Might get a little dirty, but that's beside the point. It's not a difficult thing to get kids to do. So here's this one, Naomi. I'll pass this one around.
So what is that shape?
Use these massive muscles to just get better bone and muscle development. So this one is very similar. This is for, somebody put the wrong one in the case. Okay, that's another Myobrace. There's actually a little, hi there. There's actually a little, I can't believe it wasn't in there. So, how are you?
Sorry.
You got it? No, you're fine. So we have a doctor friend joining us today who wanted to learn a little bit about Airway stuff. So there are some food things if you're hungry and some drinks over there. And make yourself at home. Okay? Yeah. So this one, without the piece that I don't have, has another piece that just fits behind the lips. And it's a tugging tool as well, but it helps them develop these muscles, robicularis muscles. And when we have kiddos that have a hard time keeping that appliance in, we really work with them with this because these muscles that aren't functioning very well. When they are beyond that, like Naomi and the McKenna kids, then sometimes we go to clear aligners. There are multiple ways to move teeth. Everybody's familiar with traditional braces. I had traditional braces. You probably had traditional braces, maybe. There are a couple schools of thought with that. Traditional braces are fantastic at moving teeth. Traditional braces pull teeth. Clear aligners push teeth, which is what I like better because not only do they push teeth, but they also help expand bone at the same time a little bit better than traditional braces. So when we need expansion and we need more tongue space for our kids who are maybe done growing, then we have to get a little more aggressive with it. Sometimes we do what's called a palatal expander, and so we'll do an expander prior to doing any clear aligners. I don't do any traditional braces, and that's for my orthodontist friends. They can still accomplish a whole lot with that, but I really like the conservative nature of the clear aligners and the fact that you're pushing teeth rather than pulling, and you're also moving bone when you do the same thing. So I brought some of those too. Now, just like if you have a box of tissues, everybody calls them Kleenex, right? Everybody sees clear aligners and calls it Invisalign. Well, Invisalign doesn't have that patent anymore to be the only game on the block. Since the Buchanan kids started, there's another company that popped up called Candid Pro, and they are very airway driven. And so any of my cases that are airway cases, I go with Candid Pro. Their aligners go a little bit more on the gum tissue, so they're a little bit better at expansion than Invisalign. Invisalign uses all these crazy bumpers on teeth, and we don't have to have that with this company. Maybe like we delivered one yesterday with 2 instead of 12. So there's that, but we can pass this around too. So there you go. Please see what those look like. Our practice is still a general dental practice. We still do cleanings. And, we can have a whole nother conversation on the importance of good gum health and how we know that people who have bleedy gums are not very healthy, and how we can do that. We still do decays and that kind of stuff. We still do crowns and my pretty smile designs and those sorts of things. And that said, there's nothing more rewarding than this airway stuff, because you're changing health pathways for kids through adults. I know. So there you go. That was short and sweet, but what do you think?